Welcome to The Bridge, a podcast for dental professionals featuring the insights and expertise of fellow dental professionals. Let's welcome our host, Stephen Kuza.
Good morning, Bridge Dental Podcast listeners. This is Steve Kuza, your resident financial advisor for dentists. Thanks for joining us. Today, we got a special guest out of Philadelphia, PA, Dr. Shah. Dr. Shah, how you doing this morning?
I'm doing well, Steve. Thanks. How are you?
I'm good. I really like the quarter zip. Hopefully, if we have a good interview today, I can get one of those. Well, Dr. Shah, I appreciate you coming on. And for all the Bridge Dental Podcast listeners, we've talked a lot about general dentistry. We talked about how to build your practice. In particular, this episode, we're going to spend a little bit of time jumping into pediatric dentistry and how you built a practice in pediatrics. You know, that's always a great area to touch on. It's a unique place in the market, in the dental marketplace. And I want you to definitely share some ideas, Dr. Shah. So again, appreciate you jumping on. For the Bridge Dental Podcast listeners, please introduce yourself. Tell us where you're at today. Let's land some foundation.
Absolutely, Steve. Well, thanks again, man. So I'm Deep Shah. I'm a pediatric dentist out of suburbs of Philadelphia. I practice out in Exton, which is, in Chester County. So what I do, it's kind of equivocated to like a three-headed monster. I'm in private practice. It's not my own practice. I work for a DSO actually, but I'm in clinic 1 week. And then the next week, I'm actually the chief dental officer for the company. We're called Oak Dental Partners. So I'm out on the road mentoring our doctors. We've got offices across 8 different states, predominantly in the Southeast. And then I'm also an attending at the University of Pennsylvania School of Dental Medicine and at CHOP. And so I run the oral conscious sedation program and laser usage for the residents down there on certain Fridays. So it's kind of nice to dabble in a little bit of academia and a little bit of private practice, getting my feet wet and, so to speak, not only, in the private practice world, but also with some, chief dental officer stuff, learning about the business, kind of things that are kind of your forte, so to speak. And so it's kind of opened up my eyes to kind of the entire realm of dentistry, so to speak.
Wow, man, we're going to have to cut all that up, man. We might need a couple episodes for you. That's a lot going on. That's awesome though. Well, wait a minute. So you have are you actually a partner with Oak or like with the DSO, or did you guys have a partnership? Did you have a private practice and then join them, or how did that come about?
Yeah, good question. No, so I just hopped in. I was an associate.
Okay.
I did not have my own practice. I did not sell to them, but I came in on as an associate looking for a new opportunity, and then kind of went from there. And yeah, lucky to be, the opportunity I have with them.
So, Dr. Shah, where did it all start for you? Let's kind of work back a little bit chronologically. I'm always curious about how dentists become dentists, and then specifically how you then started to branch into these areas of expertise that you have today. But let's start with kind of that beginning mindset of like how you got into dentistry early on.
Yeah, so I always say everyone has their own story, and for me, it revolved around the big C word, which is cancer. And I had acute lymphoblastic leukemia as a child, so I was diagnosed at the age of 2. I've been in remission since the age of 5. So it's been 30 years, and I feel super blessed and fortunate for that part of my journey. Glad that, I didn't have to go through chemo and radiation. But at the same time, it did open up my eyes to some of these kids who are going through what they're going through. So I would still follow up with my oncology team up until about the age of 19. I went to St. Christopher's Hospital, which is outside here in Philadelphia. And every time I went, and especially as you get into your teens, you start kind of the synapses in the brain just start clicking, and you start to realize, hey, like, A, you realize how fortunate you are and lucky you are, and B, you start to take shape of the world around you. And for me, seeing kids who are hooked up to IV poles, getting a chemo drop, losing their hair, and here I am, just getting blood work done, it really kind of puts things into perspective. And that was kind of, for me, the kind of defining moment where I was like, I want to give back to the community, especially with kids, kind of given how fortunate I was. Now, in dentistry versus medicine, because definitely on the fence between both. For me, it's being ambidextrous was one thing. I wanted to take advantage of the hand skills, and the ability to use both sets of hands. And then the biggest thing was just kind of the gratification. I like the instant gratification of someone coming in, they have a problem or a pain area, and they walk out with it being resolved. Yeah. And for me, that was one of the biggest kind of pros about dentistry, is that someone comes in, there's an issue, you can fix their aesthetics, you can fix their smile, you can get them out of discomfort and pain. And it was kind of like the perfect storm. Didn't really know, which route I wanted to go. I did like oral surgery. when I was in dental school. And then someone told me, dude, you just got a knack for pediatrics. And it was fun. I kind of felt like I could be my inner child again, could kind of connect and kind of have those playful moments with kids. And yeah, here I am, and the rest is history. I do a lot of oral surgery with what I do, so I'm kind of fulfilled in that part of my practice. But kind of the whole landscape and, letting your inner child come out and getting down to a child's level and really helping to shape their journey, medical journey, their dental journey, their life journey. It's been really rewarding.
Wow. So that had to be a big deal. I mean, and you grew up, from when we were talking, you grew up in Alabama.
I did.
Right?
Yeah, half my childhood in Auburn. Yes.
Okay. How long were you there?
I was there till about the age of 7.
Okay.
Yeah.
And then you guys moved to Pennsylvania?
Correct. Yeah.
Okay.
We relocated up here. As my family moved up here, dad's job. So.
Okay. And so going through this as a child, I mean, when did it click in? I mean, you're going through a lot as a child there, right? I mean, when did it kick in that you wanted to go down the medicine or dental route?
I'd probably say when I was in undergrad, it's kind of when it really clicked. I mean, you got family that tells you, hey, like you should do this, you should do this. Yeah. And then everyone wants your own best interest, but at some time you have to look for your happiness. And so I come from a family, obviously, I'm the first dentist in the family. So a lot of people are pushing medicine. And as great as it was, there's part of it once you get older, you're able to kind of conceptualize the lifestyle you want to live a little bit, the way you want to live your life. And I just realized the lifestyle for me is also a big thing, just kind of live life on my terms. And I thought dentistry also gave me that ability to, not only have financial freedom, but more so autonomy.
Did that thought process, you think your experience as a child, having cancer, going through that experience, laid that foundation for you wanting to kind of live life on your terms? Did that have something to play in it?
Yeah, I think it did. I think the biggest thing for me is like my quote. I'm on Instagram. My handle is like the superhero dentist, and so I want kids to just be their own superhero. And for me, that was kind of like what resonated with me. Is like, how can I help empower kids to be their own superhero? And what would put me in the best position to do that, where my love cup is filled 100% and maybe even overflowing, so I can give back 100%. And that's when I was thinking about the different career paths, and to give back for me, it just felt like dentistry, kind of all the stars aligned, so to speak, that allowed me to carry out that mission on my behalf. Absolutely.
I love that. The superhero dentist and that superhero mentality, that you almost feel like, man, I used to think that way, but you start working this corporate life and school, and you kind of forget that innocence of it.
Yeah.
But that's a powerful mission, or a powerful purpose, I should say. So I don't want to minimize it. So you have this cancer experience or this event, right? And it obviously shapes your life. And to that point, where I'm just curious, I'm just on my own end, does spirituality come into that? Does faith come into that? Does that help you as you kind of go through that process, or even now? Because you seem to be somewhat of a deep thinker, and I'm just curious, maybe did that have anything to do with it?
Yeah. Back in the day, it was kind of hard. So religion was kind of in my situation, religion was kind of forced upon me.
Yeah.
And so I've always kind of adverse. And like I said, it's not like I'm against religion. It's just, I'm searching for answers. And I would say I'm more spiritual based now. I think having my own kids these past 5 years, I think have really transcended my journey in more of a spiritual light. And I think one of the biggest things that really got me to kind of just contemplate things was I asked my dad. And seeing my dad, who's, my parents, both my parents, I should say, but more so my dad, the religious mindset he would take growing up. And one day I just asked him frankly, because it just felt like things were tense when it came to praying and this rituals. And I asked him, "Dad, are you doing this because you love God, or do you fear God?" And he really thought about that. And he said, he was honest. He's like, I think it's because I fear God. And I think that's unfortunately what I've come to, and doesn't hold true for everybody, but from a lot of people I've spoken to, and maybe even the South Asian descent, being Indian background, a lot of things are done because of like societal pressure, societal norms, and fear driven. And that's kind of when I indirectly pulled back from religion a little bit. And I was like, you know what? I've got to search for my own answers. And I don't want to follow something blindly, especially if it's fear-based. And, you're worried about the negative repercussions of something instead of looking at the love and the empathy and the positivity behind something.
Right.
And it's kind of hard to do that because you're always you're always looking at, your mind is subconsciously thinking of the worst possible outcome. If I don't pray, God forbid this happens. If I don't go to the temple, then, this may happen. And that just kind of got me to step back and really redefine life and my journey. And so I would say right now, I'm definitely a lot more spiritual based. I'm looking for answers. I would love to do ayahuasca. I tell people I'm really open about my journey. I would love to go down to Peru and just kind of get into tap into my deeper subconscious and just see what's in there and what answers, lie deep within my soul, I guess.
It's so funny you mentioned that. I was, and I appreciate you sharing that, because you obviously have thought about this on a deeper level. So I'm glad we actually touched on that. See, if you're listening, it's not always about dentistry, right? We're covering everything: spiritual, work, faith. But I just was listening to a podcast by Tim Ferriss, and he interviews some of the most interesting people. And I forgot the gentleman's name off the top of my head, but he was talking about going down this journey. The shamans are around and they're doing this spiritual healing. And I'm like, I remember driving in the car thinking, man, I don't think I will ever experience that. Or how do I experience that? So man, you really got to go search for it. You really got to go for it. And I love that thought process. It just, when you said that, it reminded me of like, you got to search for spirituality sometimes. You got to go get it. So that's a great way to put it.
No, it's true, man. I think, like I said, you've got 3 kids and I've got a 5 and a 3-year-old. And I think the best thing that's happened is you're really responsible for someone outside of yourself when you have kids, right? And so you want to obviously bring your A game, but then you really start thinking about a lot of things. And one of them for me was, okay, how do I just kind of tap in to be the best version of myself? And along those lines of spirituality and all that stuff, so I started meditating a lot more and trying to find Zen. Like I said, and I think you mentioned, like, having kids is a blessing, it's a challenge.
Yeah.
And the blessings it's awesome being a dad, it's awesome being a mom, but how do you deal with the challenges? And those challenges really help you grow. So it's neat. It's definitely neat.
Well, and before we get into your dentistry journey, we got to talk about your dance journey. So you have some great dance skills. So you and I were chatting about it a little bit before this, but how did you get into dance? Like, where did that come from?
Yeah, I don't know, man. That was just I had growing up. Like, I loved Michael Jackson, MJ, just the music, Usher. I mean, those guys. You just throw a beat, they jump on their feet, and they just like impress you with their moves. And so it's funny because like I played, walked on the tennis team in undergrad. Was playing like number 16, and our top 4 were these international guys who were freaking incredible. Like, it was just so much fun to watch them. But after 2 weeks of waking up at 4:35 o'clock in the morning, going for a run, just to realize like you're literally watching others play, I realized, hey, I want to drop. I'm dropping off the team. I want to do something that's a little bit more, aligned with what I want to do. I had a buddy of mine. He's like, hey, like, looking to open up a dance team, and I was like, I danced in high school for a couple of shows. I was like, let's do it. I grew up obviously watching like a lot of Bollywood as well, and so there's a lot of dancing in Bollywood, and loved it. And then I think one thing led to another, and I was just like, all right, let's get serious about this. Created our own team, and then had an inner city team in Philadelphia. And then, we just traveled. We were good. I mean, at one point, a couple of years, we were pretty good. Like, went all the way out to like Iowa. Wow. Compete against like other international squads. And the cool thing was I actually got asked to go into Bollywood to be a background dancer. Oh, wow. I was in dental school. And the problem was, it was like my second year of dental school. It would have pulled me out for an entire year. Right. And I barely made it through second year of dental school. I mean, some years they challenge you, and it's a rude awakening. If you go from undergrad to grad school, and like you're used to breezing through grad school, studying the day before exams or a couple of days before, and grad school is a rude awakening. And I could tell you, my second year was really tough for me. And I said, listen.
So Bollywood seemed interesting.
It was very interesting, very enticing. And I don't know, man. At that point, I was like, I worked hard to get to where I wanted to go. And I was paying all this tuition, and I went to Penn for dental school, and I was like, listen, if it's meant to be, it's meant to be in the future. But I don't want this to impede like the journey and the mindset that I had originally focused and put all my attention to, kind of eggs in one basket, so to speak. And if this dance journey is meant to be in the future, we'll pursue it or kind of dabble with it. Unfortunately, it hasn't come since. Do I regret it? I don't know. So that's a tough question. That might be a regret at times, but hey, I'm really content. I'm happy. I say everything happens for a reason. There's silver linings with everything. So it is what it is, I guess.
I could just almost imagine you dancing around from from op to op.
I'll still do that.
It doesn't leave you, man. It doesn't leave you.
Yeah, so it's like riding a bike. It's right. Yeah.
That's awesome. Well, all right. So let's go to dental school. So you go to your experience at Penn. Talk to us about, your dental experience there, and then coming out of Penn, kind of what are some decisions you made?
Yeah. So my journey at Penn was interesting. I was not the biggest fan of dental school. For me, I think, if I look back at it now, I still danced. I danced while I was in Penn.
Okay.
And I kind of want to live life on my terms. Like, I know I worked hard, but I also wanted to build my life resume. I wasn't just worried about building my dental resume, so to speak. So, I worked, I would study hard. I did that, but I tried to dabble in other things and enjoy other things in life. I don't know. I think it was just maybe at that time, a lot of my professors being from Penn, I had a few of them say, "Oh, this is an Ivy League dental school." And for me, pardon my French, like, that's bullshit, because like there's not all every Ivy.
You can swear. You can swear on this podcast. We're good.
Sweet, awesome. That's complete bullshit. All right. I'm like, and just that mentality, right? So first of all, not every Ivy League school right now has a dental school, so you can't even call it an Ivy League dental school. But then just to put at that platform and the pressure, and I think the expectations, I think I had a lot of professors teach out of fear and ego rather than love and empathy, which is one of the reasons I went back into academia and back at Penn, right, my alma mater, because I just wanted to say, I think there needs to be more love and empathy in the world. Being a hard ass as a professor and like, oh, I went through this 50 years ago and I'm going to put you through this, just doesn't work with everybody. It doesn't resonate with everybody. Some people will grab the bull by the horns and like, you'll motivate them. A lot of people you won't. And I was one of the ones that got really turned off by that. And so it was a challenge, got through it. Upon completion, I went right into residency. So I did 2 years at the Children's Hospital of Pittsburgh.
Okay. That
was profound. Like, that was awesome. I felt like I relearned dentistry relearned dentistry in residency, had some amazing mentors. And I think I can confidently say I fell in love with the field again. Like, I really fell in love with dentistry and what it has to offer. And at the same time, in dental school, you're kind of trained to do a certain thing. You've got to follow, if you're on this path, you really can't deviate from it. You can't think differently. And you're taught, it's very dogmatic in a way. And I thought residency was a lot more pragmatic, and you could try different things. You could explore with different materials. You have your own behavioral techniques that you can use. I mean, you're pretty much, you have your DMD or your DDS. So you're a doctor at that point. Right. So no one's going to really tell you what to do. They'll guide you. And there are certain boundaries and parameters that you have to be within, but you're also your own entity. You're like this butterfly trying to find yourself in the world, and you're flying around with different patterns until you kind of find your comfort zone. And I really appreciate that. And my mentors were super encouraging. And that was like really, really awesome. I mean, that really defined, I think, where I am today as well in my journey.
So this was, and there's so much pressure for dentists these days to, get out of school, buy a practice. And I say like almost like a dental society pressure, not like someone actually pushing them out, but you're on Instagram, you see your buddy's got a practice and they're having fun. And I'm using social media as an example, but
yeah,
it feels to me, outside looking in, that dentists are under that pressure, like get out, buy a practice, join a DSO, like you got to keep moving real fast. And so you took 2 years of residency in the Children's Hospital. I mean, let's talk about that decision. And maybe, did you feel that same pressure?
I did not. No, residency was great. I mean, it was really nice. I really felt like I was there just to learn. Every day was fun. I mean, one of the cool things with these window washers that would come in at the hospital dressed up in superhero outfits. And for me, I was like, I would wear like, a superhero mask for my kids, but I saw these window washers and I was like, you know what? I'm gonna start branding myself when I get out of residency as like the superhero dentist. So I bought outfits. Yeah. And I bought like shirts. So like on my Instagram, you'll see me like wear different superhero shirts. And I realized I just saw the smile on these kids' faces, especially once again, it was one of those things that like, it's like deja vu. It took me back to my old days.
Yeah.
And I see these kids in the chemo, in the hemonc department upstairs. They're at the window and they're seeing these window washers just coming up right close to the window, saying hi to them. And it just took me back to my St. Chris days. And these kids can't leave. They're very immunocompromised. Right. So they're not able to leave the hospital. But the smile on their face and just that moment, 5 minutes of happiness, felt like eternity.
No,
it's deep, man. Yeah,
that is especially having kids. Just thinking about that whole scenario that you went through as a young child. But I love that motivation, that purpose, that inspiration that you have. And you brought that to, when you graduated residency, right? So talk to us about your journey outside of residency. How did that kind of, how did you start to choose, or how did you get with Oak and kind of work through that?
Yeah, that's a great question. So I've had a journey, man. I've been through some interesting and some exciting things, so to speak. Not good, but like exciting in terms of growth aspects.
Okay.
So I started off as soon as I was done residency. I went to Scranton, home of the office up in kind of northeastern Pennsylvania. I worked for a family office up there. It was a family practice. Pretty much kind of started up their pediatric department. They had a pediatric doctor, but then there was no sedations being done. That's something I specialized in. So a lot of doctors come out with mentorship, and that's kind of the new thing going on. Back in the day, it's just kind of like you hop in, you saddle up, and you just go. Right. And so I had mentors. I mean, I was calling my friends, but it was just, I was the only provider in that office who was doing pediatrics. So learned a lot, and that was great. Was there for about 2.5 years. Culture changed. And that's when I started, understanding what this word culture meant a little bit. And I wanted to come back to Philadelphia and be closer to family. Joined a practice at DSO here in PA. And on my 6-month working anniversary, we got raided by the FBI. And that was something. To kind of get pushed up against like the wall, have your phone searched, you're being searched yourself. It was just a very crazy experience. And come to find out, the company I was working for, I mean, it's your typical, insurance fraud, DOJ, ICE was involved. And so it was a big deal. Had no idea. And that was a game changer.
You think about in dentistry is the FBI raiding your office.
Dude. Yeah. And there are very few people that, I think there's one of the person I know that's heard about or knew someone close to them, but to actually be in that, I was very upset. And I had a lot of spite. I was very hurt. Because almost like someone's keeping something away from you, the secret, and they do something unethical. And then as time goes on, I'm like, this is the best blessing in disguise that ever could have happened. Because otherwise, I think I would have been stuck at this place and just no opportunity for growth. Got out, took a good 4 months off. My second one was born.
Yeah.
And that was great. Just really get to spend quality time with my wife and the family. And that's when Oak approached me. They were called a different name at that point. And I was like, listen, I've gone through 2 rodeos. I got my New Jersey license. I was this close to opening my own practice. And I told Oak, listen, I'll give you guys another shot. I really envy people who open their own practices. I think it's very admirable. And a lot of people I talk to, they tell me, listen, like 30% of what I do, 40% of what I do is actual dentistry. The other 60%, 70% is managing egos and payroll and all this stuff. And for me, I just realized that that's something I just don't have in me. And I kind of knew what I wanted. I wanted a peace of mind. I want to be able to practice, do what I love, but not worry about the outside headache. So those folks that can do that, like I'm just like, how they can do all that stuff and manage a family. I told Oak, I was like, listen, or Oak Oak now. And I told him, if this works out, I want 3 months, no restricted covenant, no one's hands are tied, and we'll see where it goes. Now here I am 3.5 years later, absolutely loving it.
Nice.
Chief dental officer. And able to really practice on my terms. And I think this is the first time I realized, DSOs are not your typical DSOs, and culture matters, right? That word culture really does matter. I've been with a private practice where culture wasn't great. I've been with a DSO where culture wasn't great. So this notion that, having your own practice, and that's the definition of success is having your own practice, I think is a fallacy in the dental world. And like you're alluding to, what's the definition of success, or what are these new doctors coming out and being told? I think it's finding happiness. Like what's your comfort zone and what's your happy zone? Right. For some people, it is opening their own practice, right? And for others, it's a work-life balance.
Yeah. You know what? Look, our business model is similar to dentists with sole prop kind of setup, but to drive culture is an entire job. It's an entire part of the job. And so culture will happen over time with the people you have, right? Everything from what you have on the walls to how you come in every day. So you'll create a culture, but then to drive a specific culture, that's hard to do. And I think that's a great point in dentistry. That is, or even running your own business. That's something that people, you almost come back to it. You're like, oh, let's run the business, then we'll come back to culture, but you almost don't have a business yet. Right? So,
dude, well said. That's true. You're right. Because a lot of people don't worry about the nuances, the overhead, but it's hard to establish a culture once things take off. And like I said, it's always it should be the part of any foundation, right? Any office, I feel.
Yeah. Well, and so you've taken this journey that, and let's go back to literally the beginning of when you were introducing yourself. So you're taking this journey where you're working as an associate, you're the chief dental officer, and then you have these other roles. And using your term, like living life on your terms, is that why you chose some of these additional pieces? Like, hey, I want to continue to be fulfilled in this area. I want to give back in the academia world. I want to give back in the pediatric world. So talk a little bit about how you decided, all right, I'm going to start as an associate. I'm going to add the CDO role. I'm going to keep moving on.
Yeah. So, I mean, my biggest goal is I'd never want to lose track of doing dentistry. I think it's, kind of, it's our craft. It's mastering my craft. I want to master my craft and get better at it every day. I've learned, I think I have leaped and bound in where I am from where I started, but that progress doesn't stop. There's going to be new things, new technologies, especially in dentistry. AI is becoming such a cool and hot spot. And so to start dabbling in that a little bit is really neat. But then at the same time, I was thinking about, hey, like, how can I have a bigger impact on more people, right? I mean, we all have this dharma, right? We all want to live our dharma and fulfill our life's journey or our prophecy, whatever that means for us. And for me, I want to live life with passion, purpose, and intent. And I can affect my community, and I feel blessed to do so. If I have the ability to go out and affect another community, I would love that opportunity, especially when it comes to kids. And that's kind of what the chief dental officer role has given me the ability to do, is help train doctors become the best version of themselves. Hopefully they can learn a lot from me, but I want to learn a lot from them as well. It's a two-way street. But at the same time, maybe bring some of this empathy and this notion of culture into different areas and tapping into mindsets. Like my wife and I think we were talking about this earlier, like mindset's so big for me, the way we talk to kids. And I always say, we're very quick to correct people's behaviors in the dental field. You should brush, floss. Hey, I recommend this product. How many times do we connect before we correct? And that's so huge for me, is like, connection over correction. And especially with kids, to build that trust, to build that rapport. I remember like Dr. Halligan, he was my oncology doc. I remember him to this day, just because of the impression he left on me. And I want every pediatric doctor that I'm able to come across to be able to have that same type of impact on their guest or their, and be that type of provider. So if I can help fulfill that part of their journey, I feel like I'm living out my dharma. And so that was kind of, that aspect of it. And then, like I said, alluding to back to like, going to academia, I think as part of that was like my journey in at Penn, and the ego, the frustration, the guilt, teaching with fear. And I was like, we got to change that society. We had a student at Penn, I would say 2 years back, our first year, who committed suicide while I was still teaching, and to hear that, right? To hear the pressure that people go through. It's not easy, especially like, in the dental world. And I think a medical journey in general. So things have to change. Culture's changing. Mindset's coming, big and up to the forefront of things. A lot of people use it as a hot word. Oh, mindset. EQ. But you got to know the substance behind it and the impact it truly can make, rather than it just being a hot topic or a hot word.
Yeah, and I appreciate what you said, and I love what you said. Connect before you correct. We always talk about, you got to have a relationship with somebody before you give them direct feedback. You can't just give direct. Well, you can give direct feedback; they're not going to accept it. You can't just criticize.
Right.
But connect before you correct. And the other thing, just leading with empathy. Like to your point, you never know what somebody's going through. The old school mindset is just tough everything out. Right. And
that's it.
And that's like an old school sports mentality, right? Like just keep toughing it out. No one complain. No one say anything. Never dive into what someone's actually feeling. But it sounds like you've been able to translate that thought process through to dentistry. And so now in the pediatric dentistry, and I'm not looking, I guess I don't want it to sound critical. Where do you just see maybe just your normal or average general dentist who's running a practice who has pediatric patients versus a pediatric dentist? I guess, where does that disconnect, or where do you see an opportunity for general dentists to improve? Because we have a lot of general dentists who listen to this podcast, but where's their opportunity to connect with younger patients?
Yeah, it's a great question. Sometimes it's hard because, your office has to be kind of conducive to that environment.
That's true.
Pediatric office, the moment you walk in, it's colorful. It's,
right.
We got a game room with arcades. You're really not going to use that in adult practice. You'll have more of a spa-like experience with some of these higher end, right. adult practices, or a coffee machine, and which we still do for the patients, our parents. But it starts with, I think, that culture, the moment you walk in. And the general dentist I work with, I think my only my only advice would be like, hey, like, just know your limitations. If there's something out there, don't be afraid to reach out to a pediatric colleague. And I think that's one of the areas of dentistry where I think we can also, every profession and the interdisciplinary approach is what I'm trying to get to, is every specialty can get better at that. I think pediatric dentists need to reach out to orthodontists and communicate more, or endodontists. I think general dentists can talk to pediatric dentists more. So there's a whole interdisciplinary approach. And obviously there's multidisciplinary, reaching out to like lactation consultants and PCPs and PT and OT. So kind of bridging this gap between dentistry and medicine is great. But I think the only way you can bridge that gap is if you bridge the gap within dentistry first. And you're not afraid to just pick up the phone and have these relationships. At the end of the day, we're doing this for our patients' benefit, mutual benefit, the patient's benefit. And so and that's my answer in a nutshell. But like I said, I have a lot of respect for my GP colleagues, but it's just, sometimes it's hard because your practice just isn't geared towards that. The right, friendly stuff. True. I've got TVs on the wall. They're like this close, from a kid's face. And so
you wouldn't do that in a GP practice, right?
You're not going to do that, right? And so it's all about just understanding, it's just the small things, right? Someone's paying attention to small details that we're able to do. But then when it comes to adult dentistry, I don't have material. I don't have different colored shades and matching shades like to the precise detail. And that's where I'm like, dude, my GP, if I have a teenager who's fractured a front tooth, I'm like, go to a GP and go to this person, because they're going to make that tooth look so good and so realistic, or I'll get you out of discomfort and pain. But like, no, I want you to have top quality aesthetics along with that. And this is where, these guys thrive in. And so we have to just know our strengths, we have to know our weaknesses, and don't be afraid to reach out and ask for help or refer out when need be.
Right. And that's just an interesting business concept, because if you can get just so dialed into one discipline in general, and you could still know multiple things, but if you can become really good in one area or one or two areas, and then almost know that, hey, that's the limitation of our practice, or you find the right person to fill the other gap. Right. So that's such a good business concept. I know you're sharing it through dentistry, but it's a great business concept. Even as a dental business owner, knowing that, hey, I'm going to focus on implants, or I'm going to focus on this one key area. Hire more of a general dentist to help fill some of the other gaps in your practice. But anyway, it's a great thought process you just took us through.
Yeah.
So I've been seeing some different posts on DSOs, and remember, I'm outside looking in, so I'm one proponent versus not. I have clients in both areas. What's your thought process? You brought it up a little bit. You touched on it, this DSO versus private practice landscape. And why is there such to me, outside looking in, it feels like two different thought processes you can't seem to blend it together. But what are your thoughts on it?
Yeah, it's a great question. It's really good. And like I said, I've been fortunate to see both ends of the spectrum. I be a part of one where culture wasn't great, and now be a part of one where culture is awesome. Right. I've also had the opportunity work for a private practice where culture was not very good. And so this notion of culture is great. I think that's what the biggest thing we have to keep in mind is when you're a new doc and you're coming out. And there are a couple of them. I'm going to try to be very concise as I can with this. It's a great question, but there's many different facets.
You don't have to be concise
to look at it. Okay. So the first aspect is from a culture standpoint, right? The culture is changing nowadays. And so that's one of the reasons why some of these newer DSOs are really trying to come out, and they're trying to really emphasize culture. And what I ask people is, when you go to a dentist, whether it's a pediatric dentist, an endodontist, a general practitioner, orthodontist, what's the one thing everyone expects? Everyone expects great quality of care. Right. You're not going to go to one person over another person and expect the quality of care to differ. And you're going to expect good quality of care. But what's going to differ is going to be the experience. How is that care being driven, from the way you're greeted at the front to what's in the waiting room to maybe music or a scent in the office. So small things like that will really help create that 5-star experience, so to speak. Yeah. And we're living in the day and age where everything is this, like communicating through the phone. And I ask people, when you go somewhere, if you're going to Hawaii on a vacation, how are you going to figure out where you're going to stay?
Right.
Google reviews, right? Check. And I was like, we're no different. And we have the ability to give, we're doing a service, and people value that service, and they're going to rate us based on the service that we're giving.
Right.
And, I think, it's just, we're just in a different industry or different business. The other aspect of the DSO clash is, I think a lot of this is also status quo and the inability to realize that times are changing. a lot of this DSO notion, I think, comes from dental school. A lot of these professors are living, or they're teaching, are a little bit old school. I don't mean that in a negative way.
No,
they
ran their practices 20 years ago, right?
Yes, and a whole different generation, a whole different era, where to their, I guess, to their validity, yes, DSOs had a very different connotation and meaning back then. And a lot of the things that you hear were true, and in some places are true. And that just comes down to kind of the ethics, the culture, the kind of, like I said, culture is the big word. It's kind of what drives everything, though, right? It drives how the ethics, the integrity, how much you're paying your staff, how you're talking to your patients or your guests. You hear this word guest now. A lot of these places are calling their patients their guests, because just like any other place, our guests have choices and they're coming to see us. So we're going to roll out the red carpet for them and make sure they come back to see us all the time. And so I think I tell these new doctors, or even some of the doctors that are out there, challenge the status quo. Think for yourself. Dental school, we're just used to being fed everything, right? Right. Colgate and Crest came to every single freaking event. They sponsored everything. But if you look at Colgate and Crest, they're also some of the cheapest toothpaste out there. And if you look at most dentists, we can afford going to Wegmans, Whole Foods, Trader Joe's. Right. So you're spending high quality food for spending crappy quality on toothpaste. And it's kind of So there's other toothpaste brands out there that do just as great of a job, actually even better than Colgate and Crest, are healthier, have much better ingredients. And so these are things I try to get people thinking in just a different way. We're so domesticated from the day we're born, and dental school domesticates you even more, because you fall into this mindset of this is how you're supposed to think and do things. And the one cool thing I like to just tell everybody out there is if someone's having a heart attack, we're giving them something called nitroglycerin. Right. And the way we give nitroglycerin, which is for chest pain or angina, we're giving that sublingual, under the tongue. So I tell my residents all the time, why are you giving something for the heart through the mouth? And it's because the permeability, things get absorbed quicker. Right. So ingredients matter, especially when it comes to toothpaste. And we're starting to see that stuff now. There's a reason why some people are more prone to canker sores than others. And it's the ingredients in the toothpaste that can cause these things. And so
I'm one of those.
If we're going,
the wrong toothpaste will mess me up for a week.
For a week, right? Yeah. And so, and I say everything in life is a bell curve, right? The majority of us fall in the middle of the bell curve, but a lot of us are now getting outliers with epigenes, and we're all wired differently. Our environmental factors are going to change things. But I think we have to be open and understanding to the notion of that, is that there's no one size fit all model. And sometimes I think as dentists, we do get narrow minded. And I've been in that boat before too, where you just get very focused on the care and what you're taught. And I'm going to do things this way, without opening that box up a little bit and let things kind of come out the box and look at things from a different perspective and reteach things, a lot of things. I think that's the best growth, is just be okay, have an open mindset, and be okay to learn and relearn new things.
Well, I think if we've had a common theme is, you've researched stuff that you wanted to know more about. You've experienced stuff, both private practice, DSO, residency, pediatrics, GP, oral surgery. So you, if you had a question about it, or if there was a positive or negative thought about it, you explored it. And I think most people just hey, my mentor told me this, so that's the direction I went. My mentor told me this, so I explored that plus the opposite of that. That's the theme I'm kind of gathering from you. I guess if I was listening to this, I would say, man, he must have an insane Excel sheet that keeps track of everything. But I'm curious too, how do you balance, or how do you track stuff, the stuff that you're working on, either through work, personal life? Do you have, something specifically that you work on a daily basis, or just maybe navigate that routine for us?
Yeah, I mean, for me, no, I really don't have any Excel sheets. I should be more organized. I think make my life easier, especially when it comes with my wife. I think she'd really appreciate that. But I think it just comes down to a routine, right? Something that helps you fill your love cup first. And that's the big thing for me, is that, like I said, 2 boys, you got 3 kids. It's hard to give back and hard to be fully present in the moment if you're not able to take some time out for yourself. And usually the best way I've come to do that is first thing in the morning. So my routine usually is wake up 4:35, go to the gym, get a workout in, whether that's, a little bit of swimming one day, the next day, some cardio and, lifting. And then I'll meditate every day. I meditate in the sauna. And that's something if there's one thing in the day that's a absolute deep, what's something you can't live without, it's meditation in the sauna. That to me is my it's peaceful. I feel like I'm releasing toxins, and I feel like just I'm in a really good headspace after that. And so that's like my best part of my morning, my day. I get to come home. Now that I have, I'm able to live life on my terms a little bit more. I'm able to help, get the boys ready for school. Some days drop them off. And when I come home, and I'm working on this really good too, working on this really well, trying to get better at this, is just being present in the moment.
Yeah.
And so
this
is why I love kids. It's hard. I freaking love kids. They will put you in check.
Yeah.
I was on my phone this was last week, and my oldest Aryan goes, "Daddy, phone away." Just like that. I was like, son, you're right, dude. You're right. And I said, that's why I love kids, because they will fact check you so hard. I mean, it's worse than a hockey check, dude. I mean, you can put right into your place by someone who's like, but you're like, and we're talking about their intention is so pure. There's no negativity behind that thought. It's just, I want to spend time with you, Dad. I love you. Put your phone away.
Right.
And if you could say that, like, damn it, Dad, put your phone away. And that's what he's telling me. And I love that. And I said, we're so, I mean, you're so successful, Steve. I'm successful. Like, we sometimes get caught up in our success.
Yes.
But the best success is this like little kid here next to us, man. That's our biggest success in life.
Right. It's the biggest blessing we have, man. It's the most biggest blessing,
man. The way we're shaping their environment, their world. And I've really started to really be attuned with that. And so that's really helped me. So the best part of my evenings, outside of like me time, when I fill my love cup, is now pouring that back to them, putting things away. If it means I'm on my knees and I ripped a hole in my pants from like playing cars, so be it, man. Yeah. If it made their day, it made their day. If I had to take a Motrin every now and then just because my knees hurt from like being on the ground and squatting with them, so be it. But it's those small things I start to cherish a lot more now.
Yeah, look, man, I have 8 consecutive losses in Battleship, so I get it. So, well, look, I think, if anyone from listening to this, you have a great way with words. You think, one, before you speak, you have a thought process. It seems like you also have a philosophy that, and almost an inspiration that you're trying to discover and learn and keep growing. You're not right. You're just trying to learn things a different way. It's not that, hey, I'm right all the time. If it's not right, I'm going to try to find an answer for it. And I kind of feel that as you speak through experience, and I really appreciate with sharing some of those thoughts. And I think this podcast will give some insight into like, hey, just take a moment, absorb the information, and then go experience it and see what it does for you.
Yeah, man, I think you nailed it, dude. I mean, the biggest thing that we all sometimes have a hard time doing that is like we have our own insecurities and traumas.
Yeah.
And you said something earlier, and I was going to talk about this and it kind of slipped my mind. It just came back. But, I think that's the biggest thing is once you can kind of really tap into your own insecurities and traumas. I mean, we are who we are because of our insecurities and traumas. And unfortunately, a lot of it stemmed in our childhood, the good and the bad, but it's really helped to shape where we are today. And I mean, like, let's get a lot of dentists have egos. You worked hard, you got your DND, you went to dental school, but I would say, check that ego at the door. I tell people, I wear my pants just the way anybody else does.
Right.
I wish I could jump up in the air, boom, like my outfit's on. No, one leg at a time. It's just how life is. We're all human beings. We're all craving for connection, love, to be heard. And in pediatrics, kids are no different. But I think just in order to become better connected with those around us, do a little deep dive, get out of your comfort zone. And whatever that is for you, it could be quiet time, 5 minutes. It doesn't need to be meditation. It doesn't need to be going to the sauna, but it should be something that you really value and enjoy that brings a peace of mind and clarity to your life. That allows you to just kind of do a deeper dive and introspection to who you are, where you came from, where you want to go, and how do you want to impact those in your journey along the way.
Well, I was going to say, hey, do you want to wrap this up with any final words? And you knocked it out right there. You knocked it out of the park, man. You knocked this podcast out of the park. I really enjoyed our conversation.
I did as well, man. No, thank you for having me. This is awesome.
I would love to have a beer with you too. I mean, we would have, we can keep getting even a little deeper. So it's been a great time to connect with you. One more thing. So,
sure.
When people are listening to this podcast, there are some people who maybe even want to get into pediatric dentistry, want to understand DSO, what you experienced in both worlds. How can they connect with you? Where should they connect with you?
Yeah. Instagram is probably the easiest thing because I'm big on social media. I think that's kind of like what's playing into a lot of things nowadays. Yeah. So my handle on Instagram is at the superhero dentist. And then my email is totally fine as well. My email address is Dr. Deep I Shah at gmail.com. And that's DEEPISHAH and so pretty good. Like I said, I'm connected, with my devices. I'll get back to you usually within 24 to 48 hours.
Okay.
But those are probably the two best ways to get a hold of me right off the bat.
And we'll pop that into the show notes. And anytime you're in Michigan, in Detroit, which there's not many reasons people come here, but if you do show up, let me know and love to connect with you.
It used to be the baklava. Now I got you. So
that's right. That's right, buddy. All right. Well, I appreciate it again, Dr. Shah, and for all the Bridge Dental podcast listeners, thank you for listening, and we'll see you next episode. This is Steve Kuza and Dr. Shah wrapping up.